Now we're now moving on to another change to the governing body agenda, and this is a feature that has been introduced in some of the other Sussex and East Surrey CCG governing body meetings and has been very successful. So I'm going to hand over to Alison, who's going to give us a 5-minute chief nurse patient story.
Thank you. Thank you, everybody. I'm always feel, as the Chief Nursing Officer, really privileged to share these patient stories with governing body members. So firstly, I just want to thank all the patients and our population who give their permission for us to use their stories in this forum. I think it's always really helpful, and we are always really grateful. Everybody will know that using patient stories brings to life exactly what people feel. It doesn't just look at them as a clinical condition, it looks at them as a totality of what their life experiences are. And we know that we are here to focus on commissioning high quality care, but by telling a story at governing body, what I'm hoping it will do is it will help generate some discussion as we go through the agenda, keeping us grounded in what really matters to us all, which is what we're here to do, which is to serve our local people. I've been doing this probably for about 18 months across the system, and some of the stories I tell are grounded in positive experience, where we can really see that the services that we're commissioning to our local population are making a difference. And of course some of them aren't so positive, but it also gives us then an opportunity to really think about and learn what we want to do to improve the services and experience for our local population. So I'm going to share with you today a really positive story, actually, so I thought it would be good today to do that. So I don't know if many of you are aware, but on the 14th of March it was the first World International Social Prescribing Day, and it was celebrated across the world. So I thought it would be a really good opportunity today to describe the work that Coastal West Sussex has been doing in terms of supporting social prescribing across all our localities. So I wanted to share an example about a gentleman who's really benefited from this initiative. Earlier this year, the Social Prescribing Service in Regis were asked to see a young man by his GP. His GP was quite worried about him. His health was deteriorating, and he was becoming quite depressed. He's in his late 20s. He's been sleeping on the street, and he's been homeless for about 8 years. He's clearly had a difficult childhood. In his teens he became involved in drugs, and like a lot of young people, described himself as getting involved with the wrong crowd and fell out with his family, so became quite socially isolated. Thankfully he's no longer involved in drugs, but he was presenting at his GP with regular health issues resulting from his lifestyle and living on the street. So he was referred to the social prescribing team, and he met with the coordinator a few times and shared with them what he really wanted for himself and what really mattered to him. So he wanted to, like most of us, have his own home. He wanted to hold down a job, but he felt for him that this was a bit of a pipe dream and he wouldn't be able to achieve that. So after meeting with the service and he positively engaged, he agreed to go with the coordinator to Stone Pillow, which is, some of you may know, is a local homeless charity. For him, he got a place in a 16-bedded hostel. And so for him, this was the first step in towards getting off what he called the street. A week later, he was transferred into a shared occupation house. So that was the first positive step for him, because with a fixed address, he was able to, with the coordinator's support, go to the job centre and make his first steps in getting some employment. The job centre staff he described as being brilliant, and they talked him through all the things and options that were available to him. He received support in terms of budgeting, and making sure he's able to pay his bills and manage his affairs. After about a month, he moved into a one-bedroom flat with the help of his coordinator again, and he was able to access support to help furnish it and kit it out in terms of all his basic needs. What I'm really pleased to say for him, he's now working full-time, and this has all happened within 3 months. And I think I want to just finish by saying what he has said. He's now living the dream that he couldn't have done without the help of the social prescribing service. So I think for me, sharing this story today, you know, we're going to be talking about the West Sussex Health and Wellbeing Strategy later on in the agenda. And this for me, it's a real clear example about how health, care and the voluntary and community partners can really work together to get some really good outcomes for people in our population. Thank you.
Thank you, Alison. Anyone got any questions or observations or anything they want to contribute to what Alison's just shared?
It's very much a positive, it shows a positive impact that support can make to people's lives, and I think it's a really, really important thing to remember, you know, in terms of the services that the NHS does. So I think it's, I have heard this one before, and it is absolutely fantastic.
Just to say that I think as a GP on the ground, I think social prescribing is probably the most powerful and meaningful tool that's come online for patients' lives since I've been a doctor. And it just shows how low-tech, sort of bespoke, patient-centred care can really, really make huge differences to health outcomes.
I just wanted to say that we should feel proud that we have led the way in this, because we used our GPTM money to fund the social prescribing program way ahead of the national direction which came through with the new contract. And I think we should feel very proud of that.
And thank you very much. And it's one of the key transformational initiatives that we've set out in the Health and Wellbeing Board strategy. So there's a lovely read across from that story into what we're going to be talking about later on.
Thank you. Hannah?
Just an observation to say, can we share that story out with our membership to encourage GPs to use it?
Yeah, thank you, Hannah. I think again, following my last round of governing body meetings, that was one of the requests, and I think for me I've just got to think about how we do that, because it would be good to share all the stories that across all our memberships, so that there's some learning, cross-learning. So I'll take that away and think about maybe with Laura about how we do that.
Alison?
It is a really good news story, certainly in relation to social prescribing. I think the disappointing thing is, though, that we are going to have to be communicating much more with voluntary organisations such as Stone Pillow, because I know that the funding in relation to the homeless in this particular area through the local authority is actually being reduced quite dramatically next year. So there will need to be, for that particular scenario, different ways of doing things. And, you know, obviously rely very heavily on voluntary organisations.
Dominic?
I just think hold on to that thought about social prescribing. We're out meeting members of the public at the moment, and one of the key things that's resonating in those meetings is about the value of social prescribing, and I think that's running through our business plan, and it will run through our development programme coming forward. So I'm really pleased that actually by here what we've done has been so successful.
Sorry, behind my
The new PCN's contract that's coming in puts the impetus on all these practice groups to find their own social prescriber, and I think there isn't a whole load of trained social prescribers ready to apply for those jobs. So as a CCG, we've committed to supporting the new clinical directors and the PCNs. Perhaps we could consider how we could support the social prescribers, because I suspect as a role to carry out, it's probably quite a tiring, exhausting role, and even if all we can do is help them have peer support, that perhaps would be enough. Because what we don't want to be talking about in a few years' time is yet another workforce shortage. If we can see it coming, what can we do to help this new profession feel valued?
Jane?
The other thing that I attended a voluntary sector meeting last month, and I think I had quite a number of voluntary sector organisations asking I mean, you know, how can we join the register to become for the social prescribing thing, and what is the mechanism? Because they weren't aware of it, and actually I didn't know either. But I just said, okay, I will go back and at least think about it, because I think that we somehow need to develop that and make voluntary sector organisations aware so they can become linked into that, particularly as social prescribing is growing.
Thank you. Any further points? Thank you, everybody. I think that was a really rich conversation. Oh, sorry.
I just thought I'd share some good news, particularly I think in light of this story. So we've just heard this week that we've been successful in receiving money from Public Health England for a capital project in Bognor Regis in partnership with Stone Pillow to convert a property which is primarily going to be aimed at hard to reach problem drinkers, but also for people who are homeless in that area. And there's also a partnership there amongst GPs, dentists, counsellors and other services who've committed sessional time to that premises once it's up and running. So another positive story for homelessness in Bognor Regis.
That's good news. Thank you, Anne. And thank you all for your contributions to that discussion. Really good.